Vacutainer procedure. Perform your 40 to 60 second hand wash. Call in your next patient, greet them in a friendly manner and tell them your name. Ask them for their referral and Medicare card. Once you have briefly looked at what tests the doctor has requested, ask them if they are happy to continue. For example, your doctor has requested for you to have a blood test. Is that okay? Once you have consent to continue, you need to formally identify your patient. Ask them to please spell their surname. Please spell their first name. Can you tell me your date of birth? What is your address? And what is your best contactable phone number? This is usually a mobile. We need to ensure that the Medicare card details match what is on the referral, and fill in the Medicare card number on the top of the referral if the doctor has not already done so. Check that the patient is seeing the doctor that is on the referral. He may also request a copy to doctor. We also need to check their details. Ask any questions required for any pre-test criteria and write them in the clinical notes section. These questions might be relating to fasting, withholding medication, or simply listing the medication the patient is taking. Ensure that the patient is seated comfortably in the chair, and we explain the procedure to them. Sanitize your hands, apply the tourniquet and palpate for the best vein. Once you have selected a vein, loosen the tourniquet and sanitize your hands again. Gather the equipment into your kidney dish. You will need 5 things: tubes, multi-sample needle. This will either have a green or a black end, a barrel, a cotton ball or pozzolan, and lastly, an alcohol swab. Take this straight to your patient and swab the selected site and leave on their wrist. Now to assemble. Take the barrel with the small hole in your non-dominant hand, ensuring you are holding the coloured end of the needle in your other hand. With both of these in your hands, twist both ends of the needle until the paper seal is broken and the white cap comes away. Drop this white cap into your kidney dish and immediately screw the exposed end into the small hole of the barrel. Screw this clockwise. Stand the barrel upright on your workstation. Remember, we never place the sharps into the kidney dish. Apply your gloves and place your dish on your non-dominant side within reach. This will be either on your workstation or asking the patient to hold this in their lap. Retighten the tourniquet. Pick up the barrel in your dominant hand using a pistol grip. 2 fingers behind the barrel and your thumb on top. The rest of your fingers should be tucked away, or if they fit onto the rest of the barrel, you can keep them there. Return to your patient standing directly in line with the vein. Uncap the needle and drop the lid into your kidney dish. Touch the alcohol swab with your non-dominant hand and repalpate one last time to ensure that you have the right vein. Ensure the bevel of the needle is facing upwards. This is the eye of the needle. This is to ensure that the sharpest part enters the skin first. With your thumb of your non-dominant hand, pull the skin taut and away from the entry site. This is called anchoring, and it prevents the vein from rolling and the skin from puckering when you enter the needle. Warn the patient of a sharp sting. Enter the needle and ground the back of your fingers against the patient's arm for stability. With your non-dominant hand, introduce your first tube into the barrel, using your pointer finger and middle finger on either side of the wings of the barrel, and pushing the tube on with your thumb. You will hear a click when it is secure. Blood should now be filling into your tube. Loosen the tourniquet. At this point, look up to observe your patient. Look for any signs of excessive pain by wincing. Look at their colour and any signs that they may be feeling faint. Their facial expressions will tell you what you need to know. Every tube has a vacuum in them. They have just the right amount to fill the tube with blood, so they will never overflow. If you are unsure if the tube is filled, simply remove the tube and hold it up to the light and check. But it's usually when the blood stops moving in the tube that it is full. To remove the tube, wrap your pointer finger of your non-dominant hand around the bottom of the tube, and with your thumb, push against the barrel, pulling the tube out. Make sure the hand with the needle and the barrel in it is grounded against the patient's arm, so you don't pull the needle out while you are removing the tube. Once the tube is free from the barrel, invert it 6 to 8 times gently. Continue to fill all of the tubes required for testing, as per all health training order of draw. Pick up the cotton ball or Pathology with your non-dominant hand, holding between your thumb and pointer finger. Hover over the needle in the arm. Remember, we never put any pressure on the needle while it is still in the arm. As you exit the needle from the arm, you apply pressure with the cotton ball or Pathology. Ensuring the needle is away from both yourself and the patient, ask them to apply pressure. You need to discard of your needle with one hand. Insert the needle into the container. Sliding from the big hole to the small. Lock it in and screw anti-clockwise. Once unscrewed, slide the barrel to the larger opening so that the needle can drop off. Place your barrel into the dirty container for washing at the end of the day. You then need to label your tubes with the patient's surname, first name, date of birth, date of collection, your initials, and the time. You then need to ask your patient to verify their name and date of birth on their tubes by showing them. Apply the barcodes to the tubes now and place them into a biohazard bag. Check that your patient has stopped bleeding and apply a dressing. Give aftercare instructions and remove the tourniquet. Ask your patient to sign for Medicare, and you can now discharge them, wishing them a good day. Tidy up your workstation. Complete the referral, ensuring that barcodes and the day sheet are completed. Place the referral in the front pocket of the biohazard bag with the tubes. You can now remove your gloves and sanitize your hands. Place your bloods with the referral into the processing area, and now wash your hands with soap and water.